Hello everyone, my name is April Marasigan under our NVP Cohort 9. And my presentation is all about bulimia nervosa. Bulimia nervosa affects many individuals worldwide. As healthcare professionals, it is our duty to raise awareness, understand the complex detail of this disorder, and offer the best possible care and support to those impacted by it. Bulimia nervosa is an eating disorder that is distinguished by binge eating and inappropriate compensatory ways to control weight with potentially dangerous consequences. Signs and symptoms may include preoccupied with body shape and weight, repeated episodes of eating abnormally large amount of food, feeling a loss of control during binging, using laxatives, diuretics, or enemas, carotid swelling, and abnormal laboratory values. Bulimia nervosa can influence both sexes but impacts women more than men. Onset occurs on average around 12.4 years of age. According to estimates, there are 0.9% of teenagers who have bulimia nervosa, 1.5% of women overall, and 0.5% of males overall who have the disorder in the United States. It is unknown how common bulimia nervosa is in developing nations, although estimates of prevalence from North America, Australia, and Europe range from 0.1% to 1.3% for men and 0.5% to 2% for women. The etiology of bulimia nervosa is not clear but is probably multifactorial. The binge-like behavior connected to this illness may be influenced by the anomalies in interoceptive function, notably of the insula. According to our research, people with bulimia nervosa have general abnormalities as well as diffuse changes in the structural and functional connectivity of the white matter, notably in the pathways that control hunger and reward the sense of taste. Other studies have indicated a possible altered function of intrinsic functional brain architecture. Anatomy and physiology of the brain. Bulimic women have alterations of neurotransmitter systems known to contribute to the modulation of feeding, mood, and neuroendocrine function. Peptide. Increased peptide activity can contribute to the powerful and uncontrollable drive of bulimic patients to binge. And the serotonin helps control everything from memory and learning to sleep, mood, and appetite. The case I'm presenting now is Charlotte Smith, 24 years old, female heterosexual, born and raised in Regina, Saskatchewan. Charlotte currently lives in a rented apartment in Regina. Charlotte's bulimia nervosa started 3 years ago during college. It has been a chronic condition with intermittent periods of improvement and relapse. Charlotte does not have any psychobiological disorders. However, she has been diagnosed with mild anxiety and mild depression, which have been related to her eating disorder struggles. She has no support system, the nursing process, direct quotes, and therapeutic communication. Charlotte, I'm here to listen and support you. How are you feeling today? The nurse used therapeutic communication skill, active listening, and Charlotte, it seems that you've been going through a lot. Can you tell me more about your feelings? The nurse used therapeutic communication skill, open-ended question. The nurse must establish and maintain a therapeutic relationship in which the patient will feel safe and hopeful that positive change is possible. Active listening helps strengthen the patient's ability to solve problems. By giving the patient undivided attention, the nurse communicates that the patient is not alone. This kind of intervention enhances self esteem and encourages the patient to direct energy towards finding ways to deal with problems. And open ended questions and comments encourage lengthy responses and facilitate the expression of thoughts, feelings, and information about experiences, perceptions, or responses to a situation. The NANDA priority nursing diagnosis: imbalanced nutrition less than body requirement. The treatment goal: Charlotte will establish a dietary pattern with adequate caloric intake to regain, maintain an appropriate weight. Intervention: collaborate with a registered dietitian to develop a personalized meal plan. Evaluation: evaluate weight and nutritional status regularly to determine improvements in nutrient intake and body requirements. Treatment outcome: Charlotte will demonstrate a steady and sustainable weight gain or maintenance with improvements in nutritional intake and body requirements. In effective coping, treatment goal: Charlotte will demonstrate improved coping skills and emotional regulation, leading to a reduction in the frequency and severity of binge purge behaviors. Intervention: implement cognitive behavioral strategies to help the patient identify triggers for binge purge behaviors and develop alternative coping mechanisms. Evaluation: observe the patient's use of coping strategies during stressful situations and provide feedback and reinforcement. And the treatment outcome: Charlotte demonstrate a decrease in the frequency and severity of binge purge behaviors, indicating progress in managing emotional distress and reducing maladaptive coping mechanisms. Pharmacological interventions: the most common antidepressant medication studied and prescribed for bulimia is fluoxetine, known as Prozac. It is currently the only antidepressant medication approved by the FDA for bulimia treatment, as it has been shown to lessen the frequency of binge eating and vomiting. The common side effects include drowsiness, dry mouth, fatigue, insomnia, loss of sex drive, and nausea. Patient teaching: the nurse emphasized to Charlotte the importance of taking fluoxetine as prescribed by the healthcare provider, and do not suddenly stop taking the medicine without checking first with your doctor. Also, advise her to seek medical attention right away if you have symptoms of serotonin syndrome, such as agitation, hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness, twitching, loss of coordination, nausea, vomiting, and diarrhea. There are available community crisis center and community support resources and crisis intervention resources, such as Canadian Mental Health Association, Mental Health Clinic, Mental Health and Wellness Resources, Regina Mobile Crisis Services, and North Saskatchewan Piwapan Women's Center Crisis Line. Here is my references for my PowerPoint presentation. That would be all for my PowerPoint presentation about bulimia nervosa. Thank you for listening.